I want to talk to all the runners, all the cyclists, everyone who is involved in endurance sport. I want to advise about iliotibial band syndrome. We call it ITBS. It's one of the most common overuse injury that we see in sport, especially in endurance athletes. If you have pain around the knee, on the lateral aspect of the knee or on the side, outside of the knee, chances are you have iliotibial band syndrome. Very irritating pain, very cutting and sharp pain sometimes, burning pain sometimes. It's usually felt around the area 2 or 3 centimeters above the joint line around the knee. So it involves the iliotibial band, which is a very tight and thick band which extends from the hip region all the way down to the knee. So it's a connective tissue, very thick band, which assists in controlling hip and controlling knee during activity. And it participates also in the flexion and extension of the knee, the bending and extending of the knee, especially 20, 30 degrees of movements there. So the more you do those movements, the more it gets tighter, or there's more irritation and compression of the soft tissues around where this band is inserting by the knee. So there's a lot of tension there. So if it's tight, if there's weakness of the glute muscles, then you will suddenly have this problem. And it gets tighter when you're running downhill, where there's a lot of eccentric control. So if the muscles of the glutes are weak and the biomechanics is altered as you run, then you start to come into problems. So this is a problem that relates to load. It relates to the activity that you do. So one of the biggest risk factors is doing too much too soon. Sudden increase in load, sudden increase in mileage or kilometers accumulated, sudden increase in speed. That's number one factor, a contributor to this problem. There's also an issue of weakness of the muscles of the hip, especially muscles that are responsible for hip abduction. So if those muscles are weak, they tend to cause knees to come together. Once you are tired, you see a lot of runners running with knees coming together. Why? Because the hip abductor muscles are weak now, are letting go and are causing your knees to collapse inward. So if the hip abductor muscles are weak, those are your glute medius muscles. If they are weak, then you run into problems. So if your hip control muscles are not strong, over time as you do activity, then you come into problems. So to poor control of muscles and high load or sudden increase in load, that can cause an overuse. Good news, this can be prevented. You can do something about it. In fact, you can lower the risk of injuries by controlling the load. Gradually increase your load. When you are training, don't suddenly increase your mileage. Rule of thumb, if you want to gradually increase, don't increase more than 10% weekly. Yes, you must progress, but 10% or less every week, you can do the increment in that way. Then you can be safe. Monitor symptoms. You can't push through pain. You're going to make situation worse. Another tip, strengthen your muscles. There are many exercises you can do to strengthen your hip stabilizer muscles. Lie on your side, do some abduction, raise your leg up and down against gravity, and then later introduce weights just to keep your muscles stronger that controls the hip. Do your clamshells, lie on the sides, bend the knees and hips, just keep abducting your hips against TheraBands or against weights. It's another exercise. Do your hip thrusts, your glute bridges to strengthen your glute muscles. There are many different types of exercises you can do that can strengthen your hip muscles. Stretch those tight muscles, that whole band. You can do some stretching exercises. You may not do much about the actual band, but the muscle higher up, your tensor fasciolateral muscle, can be mobilized, can be stretched. in a way it can relieve tension around the knee. So stretch those shortened muscles, strengthen those weak muscles. That will help you correct your biomechanics of running. That will help you relieve the problem or prevent you from this problem. There are many ways of treating it. If you already have pain, you can apply some ice around that area where it's painful, reduce the load, stop the training for some time, and allow inflammation to go down. You can strap it to support it. There are different strapping techniques you can use to support. Please see your physiotherapist to assist you first to diagnose the problem, to treat it, because you need to address pain, swelling around the area. Physiotherapists will help you with the appropriate exercises that you can do to make your muscles of the hip stronger, to stretch those shortened muscles or structures, and to assist you with managing your load, because the biggest problem is load management. We get too excited, we get to overtrain and do too much too soon. We don't rest enough, we don't recover enough. So these are things that you need to be aware of. So my advice is do something about this. I hope you find this beneficial.